Welcome back to Latch and Learn, the podcast dedicated to exploring the journey of labor, delivery, and breastfeeding. I'm Jess, your host, and I'm delighted to continue our exploration of all things maternal health. I just want to take the time to say that I'm extremely sorry that the episode did not come out on Wednesday. The week literally just escaped me, and I guess my two little ones really got the best of me in the last week. So I didn't really have the time to sit and do the episode. So here we are. So I just wanted to apologize for that. Hopefully we won't have any other further delays, but I'll keep you guys updated on that. So thank you for your patience and understanding. In today's episode, we're going to be touching on the different birthing options available to expectant mothers. So we're going to be mostly talking about the setting of the birth, so hospital versus home birth, water births, C-sections, all those kinds of different options, as well as medicated and non-medicated settings or births. It's essential to know all your options to make informed decisions that align with your birth preferences and values. Additionally, we'll be discussing the importance of having a good supportive person by your side during childbirth and all the stages of labor. This can include a doula, your partner and a doula, a midwife. Really, the options are endless. It's really on who you choose and who you feel comfortable. Healthcare professional or family member is irrelevant at that point. It's really on who you choose and who you feel comfortable with to have you and support you throughout your labor and delivery. Having a strong support system can make all the difference during labor, providing encouragement, guidance, and reassurance every step of the way. There are various birth options available to expectant mothers, each offering different approaches in childbirth, pain management, as well as support. I'll be listing out a few different settings for childbirth and what are the benefits as well as considerations to be making when choosing the appropriate setting for you and your pregnancy. So first and foremost, we have the hospital, a hospital birth, which is the most common, I would like to say, setting in which you are obviously on a labor and delivery unit where you have doctors, OBGYNs, family medicine doctors, and a whole array of healthcare staff there to cater to you and your needs. When you are delivering in a labor and delivery unit, more times than not, you are one-on-one with a nurse, and then you have the doctor that is on call or your specific doctor that will come in to do occasional assessments of their own to ensure you're comfortable. Some of the benefits to delivering in a hospital, one of the obvious ones is that you have all the medical staff ready and on hand should you need any kind of medical intervention or pain management. This is obviously the safest environment for high-risk pregnancies and any complications that may arise throughout labor or childbirth. Some considerations is that a lot of women do feel more comfortable delivering in the hospital setting due to the readiness of the medical staff or any medical intervention that might be needed. So an emergency C-section, an epidural if you've decided to change your mind last minute, things like that. Everything is more easily accessible in the hospital setting versus other settings. However, some women do find it too medicalized and are not wanting to have a medical birth at all. They're looking for more of a home birth, natural birth. So this would not be the setting for them. So then you have the birthing center, which is staffed mostly by midwives. It is more of like a home-like environment, a little bit more comfortable furnishings possibly than the hospital setting, for example. So usually it's an all-natural birth you're having here. They do not have epidurals to be giving out. in birthing centers. Some of the benefits is that it's kind of the middle ground between a hospital setting and a home birth setting, where they do have a little bit of pain management techniques or interventions that they can use. So minimal medical interventions. It's usually a natural childbirth, birthing. They do have birthing tubs available if you choose to labor in the tub. I believe they also allow you to do water births there, but I'm not 100% sure on that. Some considerations to always keep in mind is that at any given time, should the need arise, you can be transferred to the hospital if there is an emergency situation, where then the medical staff at the hospital will take over the care. Your midwife will likely follow you to the hospital, or can follow you should you choose to the hospital. But again, they are no longer your primary care provider. The hospital staff is. So they might, depending on the issue and the reason of transfer, they might have to do interventions that you may not have wanted to do at the beginning. But now, due to said emergency or said reason, they need to provide you with some kind of medical intervention. To be able to deliver at a birthing center, you have to have a low-risk pregnancy as well as a non-complicated birth. Should the birth become complicated, you will be transferred to a hospital. Then you have a home birth option. So this is delivering in the comfort of your own home. So you're very comfortable, you're more at ease. And usually you have a midwife on hand to help you with the delivery. They are your go-to person or healthcare provider for this type of childbirth. Some of the benefits is that it's a very familiar environment, so you're very comfortable with your surroundings. It's more intimate. It's more of an intimate birth. It's definitely also more personalized and intimate. And then obviously it just promotes autonomy, freedom, and more control. Some considerations to take into account is that, again, it is only low-risk pregnancies that can deliver in this manner, as well as uncomplicated births. There is obviously the risk to be transferred to a hospital should any emergency or the need for medical intervention be required. And at home, you are really having a all-natural delivery. There is no medical intervention, no pain management or pain relief options, I should say. You also have the option to deliver via a water birth. So this can be done at the birthing center, I believe, as well as in the comfort of your own home. A lot of women do choose to have a water birth at home. You can also deliver at the hospital in the tub. I know that at our specific hospital, we don't encourage this. Obviously, in a water birth, you are laboring and giving birth in a tub or pool-like environment, I guess. Some of the benefits is that it is a water birth is believed to help with pain relief, help with relaxation. The buoyancy of being in the water potentially helps reduce the risk for any type of medical intervention. And it's obviously also a gentle transition for the baby who's in the womb coming out into the world, as he or she is already in water and comes out into water and then transitions to their first breath. A water birth can make for a very soothing and relaxing type of delivery. Some considerations is that it may not be suitable for all women, especially when it comes to a complication or high-risk pregnancy. Those types of pregnancies or deliveries are really encouraged to be in a hospital setting and monitored very carefully for their risks. Also, with a water birth, you want to ensure that your healthcare professional, so your midwife, doula, or whoever it is that is your healthcare provider, that they are well trained. Finally, you have a C-section delivery. C-section deliveries can be planned or not planned. So if they're not planned, they're usually an emergency C-section. A planned C-section is a scheduled C-section where you know you're going in said date for a C-section, so you know the date that you're going to be delivering on. These are usually done when you have already had a C-section and this is your second or third C-section, what we call a repeat C-section. Or it is your first C-section and you've opted to have a C-section by choice for whatever reason, or you have a baby who is in the breech position and your hospital doesn't do breech deliveries, or you've been laboring for however long and there ends up being some kind of complication that arises and then you have to go for an emergency C-section. This is more rushed, obviously. You can obviously assume that with a planned C-section, it's more laid back, relaxed, versus when it's an emergency, it's kind of like go, 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 and everything's sort of happening very quick around you, again, for the safety of you and the baby. Some of the benefits of having a C-section delivery, especially a emergency C-section, is that it can be a life-saving procedure for either you or baby or both of you. Some considerations about it, though, is that it is a major abdominal surgery. The recovery time could be longer than that of a vaginal delivery. Like with any surgery, there are risks and complications that can occur, such as infection. And really, a C-section really should be performed only when it's medically needed or necessary. Most doctors will not recommend a C-section unless it's medically indicated or necessary. Ultimately, the best birthing setting for an expectant mother is really dependent on her preferences and her medical history and any unique circumstances that she may have. It's really important to ask the questions you need to ask to your healthcare professionals when discussing childbirth and what you expect and what your preferences are. That way they are all on the same page as you. And it also allows you to make informed decisions on things like pain meds, and it really allows you to make informed decisions on certain things, for example, like pain meds. By exploring all the available birthing options, it can really empower a woman and allow them to have a satisfying and positive birth experience that meets all their goals and preferences. Now we're going to be discussing the importance of having a good, supportive birthing partner by your side during childbirth and labor. So when we're talking about a birthing support person, obviously we're talking about the father or other parent of the baby. This usually 9 times out of 10, they are present. They're present there for the delivery. They are the main support of the expectant mother. In a lot of these settings, you can have a secondary support person. So this secondary support person can be a doula, it could be a family member, it could be a friend, or it could even be a midwife if you choose that route. First thing that a good support person will give you is emotional support. So this means encouragement, validation, and just their presence. So they will give you words of encouragement. They will validate your feelings and be present with you throughout every stage of labor and childbirth. Then you have physical support. This is physical support is like massage, some counter pressure, where they're really being hands-on with you and really helping in a hands-on manner support you through contractions, through labor, and through childbirth. They're there to help you with hydration and nutrition. So making sure that you're taking sips of water, sips of juice, eating some ice chips if you're not allowed to eat, or having light snacks here and there to just give you that little boost of energy that you will need when it comes to pushing. There's also just physical assistance with moving around, changing positions. Sometimes just a simple hand holding can make all the difference. Sometimes just the presence of their partner being there, holding their hand has this grounding, calming effect. Your support person is also there for advocacy and communication. So they are your advocate and they are there to communicate what is going on around you, since you are going to be very focused, very in your own world throughout your labor and childbirth. You're not really going to be paying all that much attention to what's going on around you. You're going to be extremely focused on you and your baby. So they're there to really advocate and advocate for you. So if someone, if the healthcare provider wants to do a certain intervention that you know that your wife or partner does not want to have done, that is your support person's job. You as the partner are there to say, hey, just a second, I don't think she wants her water broke. Something as simple as that can make all the difference in her experience. And you can always be there to help her understand her options. So if the doctor, for example, says, I think we need to start a little bit of medication to help make the contractions stronger, to help dilate her a little bit faster, since things are really, really not progressing and it's been hours. Helping your partner understand why a certain medical intervention might be needed can be extremely helpful. Having someone's unwavering support and presence throughout such a challenging and strenuous journey really can make a big difference in your birthing experience. Having that steady presence can really create a sense of security, a sense of comfort, and a deep sense of connection. As a support person, you are also there to be their support during the postpartum period. This is the big transition to parenthood. You will need to be there for emotional support as well as practical help like changing diapers, helping with bath time, and of course being there for encouragement, as that's always extremely helpful, especially when moms are feeling extremely drained and fatigued. It's also your job to ensure that you are bonding with your baby as well as bonding and connecting with your partner. So you are now a family unit of 3 or 4 or 5, depending on what you're growing your family by. Just ensuring that you are having a bond with your baby and ensuring that there's connections and needs being met. You are doing a great job at being a support person if you are doing those things. So in summary, obviously having a good support person or a good support team by your side during childbirth and labor can really make all the difference in your experience. Your goal is really to ensure that the birthing parent is supported, has all their needs met, and that their needs are being respected and their wishes are being respected as much as possible. The overall support that a support person can give you can really empower you and have such a positive impact on your childbirth and labor journey. It'll also lay the foundation for a strong and supportive start to parenthood. Thank you for tuning in to the 3rd episode of Latch and Learn. I'm Jess, your host, signing off. Until next time, take care and enjoy every moment of this journey. Remember, you are strong, you are capable, and you are not alone. See you in the next episode.